Hello, we're here today with Dr. Chris Kirby, one of my best friends in life and in dentistry. We're here on this episode 3 of Teeth and Tunes. So we're glad to have anybody tuning in that's tuning into it. It should be a really interesting podcast because today we're going to branch out a little bit from dentistry and get into sleep and sleep medicine and how that's impacting all areas of healthcare, honestly, not just dentistry. So Dr. Kirby is a graduate from Baylor College of Dentistry, 1989. We both hate to admit that, but we've been at it for a little while.
41 years we've known each other. We met the first day in the payment line, if you remember.
Yes, I do. The pain line.
Yeah.
But anyway, so graduated. You've been practicing dentistry for the majority of your career in complex care, is how I like to say that. We both started fairly early in our journeys on learning how to really impact people's lives, not just fix a tooth, but impact patients' lives through the care that we delivered. And of course, early on, understanding that you had to realize that you don't know what you don't know.
Well, I was thinking about that when I was coming up here. And, you know, after graduation, you kind of were doing your thing and I was kind of doing my thing. And I realized I had, 3 mentors in my life that I consider icons in our profession that really shaped my career. And in about, a couple years into our career, you and I realized we were on the same journey. And then we continued that journey, to learn and continue to, one of the challenges that, my mentors always gave to me was, don't be satisfied. How can we be better? What can you do better? And so I tried to make it a mission to learn something different every year to bring back to the table how I could take better care of my patients. And you happen to be on that same journey. So majority of our careers, we continue to learn together.
I know it was kind of crazy at some point when we did, kind of circle back together in each other's lives. And it's like, well, what have you been studying? And we'd been to the same places. And it's like, well, it's silly that as good as our friendship is, that we're not doing our continued education together. And so we did that. I know I believe that's when we started our journey through the Mish Institute.
It was.
Which was outstanding and combined a lot of the principles that both of us had learned from the Pankey Institute.
Yes.
And then spurred us on to learn more in depth and really more practical applications of being able to deliver very dependable care. I like to use that term a lot. Dependable. I know that Pete Dawson liked to say predictable, but something that we can all hang our hat on. None of us. I mean, I've never really enjoyed, and certainly haven't tried to steer my practice in the way of an emergency practice. I mean, if anything, we try to help our patients avoid emergencies, right?
It is. And I don't know if you can call anything predictable in dentistry when you're dealing with the human body and certainly the oral cavity. There's nothing predictable. What you try to do is exactly what you said, have a foundation for learning and go by principles we learned to do things better. And I think one of the biggest keys that I learned was really just to shut up and listen, what mattered most to the patient. And, always tried to listen to my patient instead of coming up with a solution how to fix it immediately. Try to really listen to what the patient was coming from emotionally and what mattered most. And then how could we incorporate that to how we could make their life better?
Absolutely. For any of our recently graduated from dental school listeners out there, it takes at least 2 to 5 years, I would think, in our journeys as we both look back. But I think this is across the board before you realize that you really don't know. You come out of dental school and you think, well, I know. And after being frustrated, I know my story was after being frustrated with trying to help patients with more than just let's fix a tooth. Patients would come with various problems, and oftentimes, of course, we know this today. What I didn't know was that oftentimes it's a complex care case because there's a problem with the system, not just individual components, which teeth are individual components, but the overall system, the mastication system, the gateway to our body. And dental school, I realized a number of years later that really dental school just really tries to teach us how to not hurt people.
Yeah. It teaches you the basics, what you need to do to function on a daily basis, and that's good enough for some people.
And there's a place for that.
It is.
There's a place for that. I do appreciate that.
And what you said about the young graduates, I think about that a lot too. I feel kind of sad for them, and what I mean by that is technology is better than ever. The things we can do as dentists is really better than ever, but the mentors, because of the course of where the dental profession is going and the influences that are in them, the young guys don't have those mentors who have street cred, made a lot of mistakes along the way and be able to learn from that.
Exactly. I think at some point, hopefully the pendulum will swing the other way. But we get out of dental school, American Dental Association member, Texas Dental Association member. You begin your journey as I did, outstanding organizations like the Pankey Institute and such. When we combined our pathways of learning, going through the Mish Institute, I know was a very big thing. You and I are both fellows in that, and then going through the Coyce Institute. But at some point, you began to see sleep, dentistry, and medicine as another level of service to our patients that you could provide. And there were a couple of organizations that then you began to pursue the learning objective of how does sleep impact what we do and how can it make our patients' lives better. So tell us a little bit about that.
Well, I always dabbled in sleep for a few years, but I didn't know. And so one of the first meetings I really went to was by the American Academy of Dental Sleep Medicine. I went to their national meeting, and at that meeting, they announced that they were going to offer for the first time what they called their mastery program. And it was about a 1.5-year commitment where, you would go up on a Thursday, Friday, Saturday, Sunday, come home on a Monday, but it really opened my eyes to what sleep was and how it impacts your life on a daily basis, and how we as a society have got used to poor sleep, and how sleep affects every aspect of our health. And so I committed to doing that, and so I became a diplomat with the AADSM. There also is the ASBA, is another organization, but to me, the AADSM is the flagship, and that certainly changed the course of my career. And then about that time, I met somebody, Dr. Kent Smith, and Kent was on the same journey we were. Mm-hmm. He was just probably 10 years ahead of us. And so Kent really, we developed a friendship, and I certainly leaned on him a lot in the early years about how to do sleep, not only how to treat patients, but what all else goes with it. Because when you step into the sleep world as opposed to the dental world, you're stepping into the medical world. So, wow. So sleep apnea or obstructive sleep apnea is a medical condition that luckily we have a dental solution for. And so, there was a lot to learn besides just taking care of the patient.
Right. And I know that sleep is probably one of the newer specialties included in medicine, correct?
It is. It is.
And so it's a whole new level of standard of care. I know that I did as well initially when they started realizing that some of the oral appliances could help patients that snored, you did not have to be credentialed in any way other than be a dentist and say, hey, I can make you an oral appliance.
Correct.
And I did dabble with that a little bit. I made a couple of my employees' spouses oral appliances to wear and things like that. But once they incorporated sleep medicine as an actual specialty of medicine, I realized I was probably in over my head, and the career path I was on was very, very much then into implant dentistry, complete oral reconstruction with implants and things of that nature. Because I remember our pathway split just a little bit, but you were like going, man, this is really important. And the more that I've listened to you and other guys and things, I realize, often our complex care patients, part of the reason why their system is breaking down is now we know it's linked to obstructive sleep apnea, correct?
That's correct. For me, like I said, I always dabbled in it, and then I got diagnosed with obstructive sleep apnea in 2012. That's what really changed the course for me. And I knew we made an oral appliance, but that's all I knew. So I really did a deep dive into sleep. And in about the same time at my dental office, we really made the connection that the oral cavity really does affect the systemic system, and we truly believe that the oral cavity is the gateway to the body. And when you see inflammation in the mouth, that's a sign there's inflammation, in the rest of the body. So even, in my dental practice, if somebody came in, their gums were bleeding, inflammation, we saliva test, because we know there's 4 main bacteria. When they get to a certain bacteria load, they get in the bloodstream and they affect the heart, they affect the brain, they affect the airway. And so discovering that also led me to realize, as dentists, there's signs and symptoms we see every single day in a patient's mouth that we should set up and have a discussion with them about airway. Clenching and grinding your teeth, extra bone in the mouth called tori. Forever we thought that was just stress or anxiety. And now I believe when I see wear on somebody's teeth, I think it's an airway issue, and I think we clench and grind our teeth because we have an obstructive airway. You open up the airway, you're going to shut off the clenching and grinding. So I personally just started looking at everything differently, and along that journey, I was treating myself and, realized how much better I felt when I wore an oral appliance when I got a good night's sleep, So I feel better, I sleep better, I wake up, it's better for my patients, better for my staff. So, that kept opening my eyes.
Yeah, no, I understand. When you're the patient, I know that, you and I went out to the Koi Center, and at some point you take models on yourself and you kind of work up a case. And of course, you didn't really have any wear on your teeth. And my teeth were wearing down, chipping, breaking. And at one point, whenever I revealed something to Dr. Coyce about I felt a certain way when I was going through orthodontic treatment. I went through orthodontic treatment as an adult, a 40-year-old adult. And he said, well, listen to what you just said. You just diagnosed yourself. Because actually the way my bite felt and all that during that treatment was the most comfortable I'd ever felt up to that point. And then he looked at you and he said, well, you know what you need to do. You just need to, rehab his teeth, basically add back to what I'd worn off of my teeth. I did not realize on my own self that was contributing probably to some airway problems, which was then just in a cycle contributing to the clenching and grinding. It's a cycle.
It is. It is. Think about it. You wear your teeth away. You make the size of the box smaller. You make it easier for the airway to collapse. And it's really our tongue. When we fall asleep at night, the lower jaw relaxes, and it's really the tongue that falls black and, blocks the airway and prevents oxygen from getting to our heart and to our brain,
The crazy thing that, and I've noticed this with my own patients, and I know that certainly yourself and probably others that I respect in the profession have advocated for having patients that have severe wear go through a sleep apnea test, before restoration. I haven't done that across the board. I know a lot of my colleagues don't, and some do, but I haven't incorporated that as a part of our routine approach to care. But I will say that myself, from what I experienced being the patient as well, and for a number of patients, I just had a follow-up on a guy that I did an oral rehab on, and he says, I'm sleeping better at night, and my wife says I don't snore anymore. And I know personally in my own story that that's pretty much the same thing. My wife does not notice me snoring as much as what I did. Occasionally I will if I'm really tired, or something of that sort. But for the most part, I sleep better. And I feel like, just like what you're saying, it has to be. We opened up the size of the box a little bit by adding back. I used to do a lot of subtractive equilibration, and now by far, the way I restore patients is by an additive equilibration.
Well, and I think that's changed across the board in dentistry. I think one of the biggest impacts, especially in sleep dentistry, I think it's the pedodontists who really look at airway in kids now, because we can change the course of a kid's life, development, growth, how successful they are in school by just making sure they get a good night's sleep. And I think that goes back to, once again, our pedodontists who see these kids at an early age, tongue ties. There are so many things that influence the development in children that, our pedodontists can catch at an early age and change truly the trajectory of these kids' growth. And so that's, I see an area that's really starting to change as pedodontists are really starting to look at airway. And then in orthodontics, basically what you just said, before they used to extract 4 teeth, or back when I got braces back in the, late 70s, we extracted 4 teeth. They made the size of the box smaller. They made it easier for the tongue to collapse. So now it's more about expansion. How can we open things up, make the airway bigger? I mean, even look at oral surgeons, some of the new procedures, MARPE, where they're expanding and making things bigger. It's helping patients' airway, which, affect their overall health.
I just had my 8-year-old granddaughter evaluated by an orthodontist here in Lubbock, and the conversation I had with him before he saw them, I'm like, we're concerned about airway and things. And one of the comments he made to me, which I found was interesting, but I think this goes across the board, is that he said, it's a little bit of a controversial subject in dentistry. And he said, I try not to lean too far one way or the other, which I do find, honestly, balance in that is probably good. We've lived through some controversies in dentistry before we had really social media and Facebook, and most things were either in editorials in published journals or some emails. There were the beginnings of some more digital communication processes. I'll never forget as training at the Pankey Institute and the different philosophies in occlusion and how honestly political that topic was. I mean, it was literally a political, and some of the back and forth between the dentists that wanted to treat every case with opening the bite up, significantly, and then those that really wanted to do subtractive type equilibration if you just get things fitting together. And honestly, there was a little bit of truth in both camps, but the arguments between those two was kind of fun to watch in the journals. You had to
Well,
wait a month before it came out.
You're either in one camp or the other camp.
Yes.
You couldn't be, but what you just said is correct. Even in sleep, there's no magic bullet. CPAP is a great machine, but it doesn't work for everybody.
Yeah.
An oral appliance is a great, appliance, but it doesn't work for everybody. Sometimes we have to do combination therapy. Sometimes neither one of those work, and we talk about surgery, Inspire. That's what I've learned. In the human body, there's no one size fits all.
Exactly.
It's the same in dentistry. It's the same in sleep. You have to treat the patient, and it goes back. You have to listen, and you have to find out what matters to the patient, and then you figure out how you get there together.
I remember in our journey and just understanding the mouth and being able to diagnose. Sometimes you see a patient with a broken tooth. It's easy to just look at that broken tooth, right?
It is.
But what we learned at the Pankey Institute, the Coyce Center for Advanced Dental Education, was why did that tooth break? Look beyond that tooth. And so then once you start learning to look beyond the tooth and really understand what's going on with the system.
That's right.
Then was it just a random act? And occasionally that's the case. Somebody really did bite down unexpectedly on a fork or something and break a lateral incisor, but that's really the rare exception. And I think you probably see that in sleep as well. There's not just one approach that delivers the goods. And that was part of what was frustrating before I started my journey into learning more about the oral system, was if all you have is a hammer, all the world is a nail,
Is
right?
a nail, that's right.
So you have to start really evaluating what's going on. There's so many different factors to take into the point of it is behind that airway, behind that tooth is a person. And there's influences there that really can impact the course of treatment.
Well, it goes back to asking the reason why. You touched on it. Why did this break? Why did this happen? How did it, how can we make things better, not just with the tooth, but with the system? What's going on? Take a look. And it may be just the tooth, but more times than not, it's not. It's an airway issue. It's something else going on with the system, but you don't know if you don't ask and you don't look.
And I think that thing about not knowing what you don't know what you don't know, and one of the biggest takeaways that I had early on in my continuing education journey is that it is a lifelong journey. I know that Dr. Coyce is adamant about if you take my lecture on diagnostics today and then come back in 5 years and it's the same lecture, then I have failed.
Yeah.
And I know that John totally believes that because things evolve, data emerges, and we have to follow the trends of that. We haven't come up with the absolute very best crown that nothing will change about that procedure for the rest of our life. And I feel like that's probably the same in sleep.
Well, and, one thing you said earlier about snoring, everybody thinks if you snore, you've got sleep apnea, and that's actually not true. Snoring actually comes from the soft tissue. But once again, as we fall asleep, the soft tissue relaxes. And when a little bit of oxygen is getting through, it causes that tissue to vibrate. I kind of tell patients, think of a water hose. When a water hose is kinked and a little bit of water is getting through, same thing happens to the airway from a snoring standpoint. But, key factors for patients is, if you get a good night's or get enough hours of sleep, but you're still tired every morning, if loud and chronic snoring, clenching and grinding your teeth. Those are all signs and symptoms that you might have obstructive sleep apnea. The only way to know if anybody has obstructive sleep apnea is to do a sleep study. And, that was one of the biggest complaints early on. We had to send everybody to
Yes.
a sleep lab to, spend the night overnight and do a sleep study that way. But home sleep testing has really been a game changer, is that you can sleep in your own bed. We can do a multiple night study and we can really look at what's going on. But I also think, for the future of sleep, I think technology's changing at such a rapid pace. I think we all realize how important, not just us as dentists, but I think the medical community, I think our society realizes how important a good night's sleep is for everybody, for them to function the next day. And so I see a big push by a lot of companies trying to, make home sleep testing better. How can we get more accurate? Appliances. And I'm beta testing a new appliance right now that actually has a sensor in it, and it monitors how long I wear it. It monitors what my pulse rate is. It monitors what my oxygen rate is. And then it monitors what my oxygen desaturation index is. So every morning when I get up, I download the data from my night before and see how I slept and get a score. And so that's where I see this, I see this going in that direction. I think we all realize, in fact, I was looking this up, the American Heart Association, I think in 2022, added sleep to their 8 essentials for a healthy life. And, so you keep seeing things like that changing that we never looked at before.
I know. And that touches on a question I was going to ask you about. What do you see, where do you see sleep headed? And what you said about the rapid change of our technology, our digital world, the apps, the artificial intelligence. Artificial intelligence can be good. It doesn't all have to be negative. It can be an extremely powerful tool. And I know in the area of dentistry that I'm still, focusing in, just the technology of 3D printing, 3D imaging, all of that is changing almost daily in front of our eyes. And I think you touched on that as well with sleep. It's amazing that you can put an oral appliance in that will give you all of that information. And really, that's probably just scratching the surface of where they can head with that, right?
It is. But, that's been one of the biggest complaints in the medical community, is they couldn't monitor what the oral appliance was doing as opposed to the CPAP machine. They get, real-time data on,
Right.
And so once this is approved by the FDA, this is going to be a game changer in moving forward. All oral appliances will be able to get real-time data that, the patient can see the next day, the doctor can look at. And so that's where all this is heading. And, once again, even as long as I've been in sleep, which is, about 18 years now, I see just the model and how things are going. And, you asked me what motivates me and why I keep doing. Just like you said, I want to learn something new every day. And so retiring from dentistry and devoting myself full-time to sleep gave me that opportunity. And certainly Dr. Kent Smith gave me that opportunity by bringing me on board his team, because, he is creating a model that's not done anywhere in the country right now. It's starting to develop, but it's like we actually work in conjunction with a medical group. So it allows me to do what is best for the patient. When I was just a dentist and doing sleep, I could only do an oral appliance. But having, doctors and nurse practitioners that I work with on a daily basis, we can truly do what's best for the patient. And it goes back to something I said earlier. If an oral appliance does the job, great. If a CPAP does the job, great. If I need to do them both, great. But now I have the ability to do that, which I didn't before. And it's, I learn so much every day on the medical side, looking at the different drugs they get for insomnia or narcolepsy. You know, there's so many things that I didn't know on the dental side that I get a chance to ask questions every day. So, you know, one of my goals to learn something and continue to learn, I get to do that every day. So it excites me to get up and go do that.
You know, and I think the thing about sleep studies before, and I go all the way back to the early days of when they began to suggest that it wasn't an absolute. It was a suggestion about maybe getting a sleep study. You had to send your patient to a sleep lab. They put all these monitors on you, and it's like there's no way anybody is going to sleep in any type of a normal pattern like that. And so the technology that's evolving through our digitally driven society is really amazing, that you can get probably much more accurate feedback about what's really going on with the patient if they can sleep in their own bed and be comfortable, correct?
It is. I mean, I still think that an in-lab study is the most accurate to date.
Yeah.
And sometimes we do send a patient to a sleep lab for various reasons, but I think the home sleep testing and where they're developing and what they're trying to do is, you know, it's here to stay, and it's certainly going to be the standard of care in the future. And there's some great companies out there that I love the results I get and able to interpret the data and be able to talk to the patients about. But we're on, the upslope or whatever you want to call it of sleep. I think it's still going to continue to grow and open up doors. And just every year, every meeting I go to, I'm amazed at what's new,
So, we talked a number of years ago, and I was hard and heavy, having just finished up the Mission Plan Institute. And, one of the things about me and you're the same way, it's like I'm not going to invest that kind of time and money and not come back and put that into practice. But at some point, not long after we completed that continuum, and Koish, you began your journey into sleep, and an admonishment to me, I remember, is like, you need to learn more about sleep. And my reply at that time was like, look, I'm pushing on this. I'm not going to really start at this point in my career down another career path, but I think it's great that you found that as a way also to stay active as a dentist in healthcare and such. Some people look at a certain age and say, I want to retire by then. I know we've had a number of conversations. We don't really ever see ourselves retiring unless we just have to. But where I'm headed with that is there's a number of dentists like they're out there like me that don't necessarily want to become a diplomat in the
AADSM,
and things like that. I mean, because I remember when you're going through that was a lot of work. Just like when, certain things, like when we went through the Mission Institute, that's not just a go sit down and take notes kind of thing.
It's not.
It's
very hands-on.
It's hands-on.
Commitment.
It's immersive.
Commitment away from your family. Commitment of time. Commitment of finances,
commitment of retaining knowledge, because after a point you don't get together at the time. God rest his soul, Dr. Carl Mish. Yeah. But for those of us out there that knew Carl, he expected something out of you, and so you didn't just show up and say, feed me. Carl you needed to retain that knowledge and be putting it into practice. And he would ask you specifically. But for dentists like myself that have maybe not a desire to do that, how do you proceed? Who do you work with, and what direction do you take it? Because I feel like it is something that is impacting the care that we not only deliver, but how do we diagnose what's going on? How do we head our patients in the right direction to really, truly help, because the treatment of the teeth, like I say, it's part of the system, and getting past that one tooth only type concept is a beginning, but it's certainly not the end. So, what's your advice for dentists out there that aren't engaged in sleep but need to have an awareness?
Well, I think it goes back to, I think it was in 2017, the ADA actually came out and said that dentists are now required to screen for sleep.
Mm-hmm.
We don't have to treat sleep. And so I think it would be good, for all dentists to have an awareness of, what obstructive sleep apnea is, what causes it, how it can be treated, because we see patients way more. We see them every 3 months, every 6 months. So it's educating our hygienists to look. It's the dentist. We need to look for wear on teeth, tori. You see those signs in the mouth, then you have a discussion with the patient, ask them about how they sleep. Do you snore? And once again, just because you snore doesn't mean you have sleep apnea, but it's an indication or a red flag. We need to have further discussion. But then to answer your question, I think we all need to be aware of sleep. Doesn't mean we have to treat it, but it would be great for everybody to have a relationship where you could send a patient that, they could have a home sleep study done. And if they have sleep apnea, then you work together to do what's best for the patient. From your side, you would do the full mouth restorative. And then once they're through with that, then we're able to treat things from a sleep apnea side.
Yeah. That's great.
I think it goes back to collaboration, which we all, and I think dentists do a great job of that. I think we've always done a really good job of communicating, working together, and trying to help each other out.
Well, I tell you what, I think that's a great answer and great advice for all of us. I know that I certainly ask those questions and pay more attention to it now than I once did. We're fortunate here in Lubbock to have a young dentist that's very enthusiastic about sleep, that her primary practice isn't actually here in Lubbock, but she has opened up a dental sleep center here. And for me, it's been great, because I don't see any of that. When I moved here to Lubbock from the Metroplex area, I know I talked to you about you might want to come out here some. But once I established my relationship with her and realized the journey she's on, she's actually, going. Kent Smith's one of her gurus, and it's nice. So it's very nice to know. And I'm trying to get the word out to our local dental community that we have that as an option, because, like I said, not everybody wants to necessarily treat it, but we are obligated to have an awareness. And it's really nice to know that you have someone that does have a commitment to that. They're not just trying to make a buck off of making inexpensive oral appliances. They actually care, and they have a system set up to where they can evaluate folks.
Well, I mean, whether you want to call it our tagline or our motto or what we live by at our core principles at Star Sleep and Wellness, it's, saving lives, healing relationships, and extending careers. And I get to see that every day. I can't tell you how many patients, the husband or wife are finally sleeping back in the same bedroom. That's one of the most rewarding things I get to hear is, thank you, doctor. We're now, we slept apart for 10 years because of my snoring. And it's not just men snoring. Now, I know women don't snore. They purr, but getting them back together in the bedroom, that's pretty cool to me. And just like what we did in dentistry, giving somebody a smile that truly changes their life. It gives them confidence. Next time you see them, they've got makeup on, their hair's done, they've got a new job, a new career. So it's life-changing. And I get to do the same thing in sleep, to save somebody's life because you've got them healthy, or got them sleeping better. And, if they get off blood pressure medicine because their heart's not racing all night long because they're suffocating. There's so many avenues I could go down, but it's just so rewarding. And, the part of the extending the career, it's extended my career, and I'm grateful for that. And I smile when you said wanting me to come to Lubbock. luckily, I'm with a company that is growing in all directions at the very moment. And don't be shocked if we're in Lubbock at some point in the
That's true.
future.
That's very true. Well, with that, that's a great segue from the dental and healthcare standpoint. We're on the podcast of Teeth and Tunes. And so this is one of my favorite parts of the podcast. Music is a universal language, and we all, something in a musical way will make us kind of skip around or whatever. And it can be any genre, whatever works, but everybody understands music. So with that, and I know over the course of our 41-year friendship,
Yeah.
we really both enjoy music, live music, just good music, things of that. Who are your favorite artists?
You know, my go-to will always be the Foo Fighters, Pearl Jam, and Rush. You know, those will always be my go-to. Even though I continue to try to branch, and I'm branching, that will always be my go-to.
I understand. Well, here lately, it seems like I've been on a roll of seeing some of the older musical acts, and it's so awesome to see. You see a guy like Graham Nash of Crosby, Stills, Nash and Young. He's 83 years old, can still sing like crazy, and is still enthusiastic about it. That's one of the things. Music just makes me smile, and I think that says a lot. Dentistry has an art, even with treating sleep, all of it is science, but yet art, because you have to blend some of that in when you begin realizing that you're treating a person, and there's emotions and life situations and all that going on. It's not just a specific thing. And I feel like music is part of that. If you have a good sense of even just an appreciation, you don't have to be a musical artist. You don't have to be musically talented. And I think that's what's beautiful about music. Have you discovered any new artists recently?
I have. And my first two probably aren't new. Well, they're not new, but the Black Keys' new album, I've been really impressed with. Yeah. And the Hive's new album, I've enjoyed. But for me, and I've discovered the White Lies, which has been an interesting band. They kind of remind me of The Cure and the music back in the 80s. And then Inhaler.
Oh, yeah? Tell me about them.
It's, if I'm correct, one of the musicians in it is Bono's son. And so they've got some tunes along that line, and I've just really enjoyed getting I've just got exposed to them in, the last couple of months, and so I've really enjoyed learning and hearing more of their music.
Well, I tell you what, I think that's really fitting. Because for a guy that's interested in your airway as far as sleep goes, Inhaler sounds like a great group to be.
I thought that was a great one to end on.
Yeah. All right. Well, that's fantastic. So for any of you guys out there listening, no matter what you tend to like to listen to, I would encourage everyone to branch out. I mean, go check out Inhaler. I know I'm going to. So, who knows? It might broaden our horizons and make us a better person altogether. So, Dr. Kirby, I want to thank you so much for being our guest on Teeth and Tunes. I hope you've enjoyed it.
Well, it's been my honor. And anytime I get to hang out a weekend with you and Trina, it's always a treat for me.
Well, I'll tell you what, you've been an inspiration in our life, and obviously our friendship goes very deep. But the commitment, the one thing I will say, and I want to encourage anyone out there, we do what we do. And for those of us that are dentists and involved in healthcare, it goes beyond making a buck. It involves making a difference in people's lives. I know I didn't go to dental school just to drill out a cavity in a tooth and stuff filling down in it. I want to make a difference in someone's life. And I would encourage everyone out there that's listening to, make that their goal every day. Try to make a difference in someone's life, and try to learn something new.
Every day.
Every day. All right, that wraps it up.